This is the In Focus podcast from The Hindu.
Hello and welcome to another edition of the In Focus podcast. I'm your host, G. Sampath. The institution that immediately comes to mind when we speak of food security is the Public Distribution System, or PDS, the nationwide network of ration shops that provide subsidized food grains. But over the last decade or so, another initiative at the level of state governments has made an impact. Yes, I'm talking about government canteens. The Indira Rasois of Rajasthan, the Amma Unavagams of Tamil Nadu, and the Indira canteens of Karnataka, to name a few, have become popular, especially among migrant workers in our cities. A new survey of these canteens, conducted late last year, documents their efficacy and draws some lessons regarding social policy interventions. It raises and answers some interesting questions. Why do we need government canteens when we already have PDS? Who frequents these canteens? How much do state governments actually spend on them? And are government canteens something that should be scaled up and expanded to states that don't have them at present? To tell us more about this, we have with us the economist behind the study, Ritika Khera, Narendra and Chandra Singhi Chair, Professor of Economics at the Indian Institute of Technology, Delhi. Ritika, welcome back to In Focus. Thank you so much for joining us.
Thanks so much for doing this podcast on the canteens, because I think the scheme is really exciting and I hope lots of people can hear about it.
Right. I mean, I was just reading about it, your piece, and it really was very interesting. And I think everybody would be interested to know more. To start with, Ritik, can you tell us what exactly prompted you to undertake this study? Is this the first such study of government canteens in India?
So I think, in a sense, yes, it is the first such study, in the sense that I don't think there are many studies that have done an interstate contrast. There are one or two studies on the Amma Unavagams in Tamil Nadu. They look only at the canteens in Tamil Nadu. There's one study done by the SC Mathur Institute in Rajasthan, in Jaipur, on the Indira canteens. But to have a comparative picture of what's going on and also a systematic study, maybe this is the first one, although I should also add that it's a very modest attempt. You also asked why I wanted to do this. So basically, I many years ago, I had the chance, like almost over a decade ago, I had a chance to go to Brazil, and I was interested in their Fome Zero, the zero hunger program that Lula had started. And one of the things that we saw there were these popular restaurants. So there were restaurants like the canteens, like our canteens, where a person could get a meal for 3 riyal, which was like 30 rupees at that time. And there was a huge queue outside it, like really long queue. And the food that was being given there was pretty amazing. Like there was freshly squeezed juice, there was either fish or meat, and then there were beans, and then some sort of cereal, rice or something. The people were really thronging there. So I was quite encouraged to see that a canteen-like initiative was also giving such a healthy and nutritious meal to people. And then, of course, soon after that, in Chennai, in Tamil Nadu, Ms. Jayalalitha started the Amma canteens. Of course, the meal is much more modest. But since then, I've been interested. And since in Rajasthan, this during COVID, the government there started from scratch, actually. There were zero canteens in the state before COVID. And they scaled up pretty quickly, starting in August 2020 with only around 200 canteens. They were able to scale up to more than 1,200 at the end of last year. So, but also we had noticed that these state initiatives, whether it was Tamil Nadu or Karnataka, where you have Indira canteens, or what had been happening is that when the government that initiates it, when the political party goes out of power, these canteens kind of tend to be ignored and neglected. And I kind of anticipated that the government in Rajasthan would be voted out. So I thought, while it is still functional at full strength with full political backing, we should at least document what it's like on the ground. So that was the immediate motivation. And then, of course, it made sense to do all three states because the other initiatives were older, and also to get a sense of the scale.
Right. So, how exactly do these canteens operate? I mean, are they run by the state governments directly, or does the government give them out to private contractors who hire the workers and then they run it? And like, how much what is the kind of money the state government has to spend on it? Can you take us through how the whole operation works?
Yeah. So actually, what in the course of doing this research, I mean, we were pretty clear that we were only going to three states, but I've realized over the past 6-8 months that actually many states have these canteens. So, for instance, there's something called Janakiya hotels in Kerala, which I think are equivalent to these canteens. For 20 rupees, I believe you can get a meal, and there, in fact, they do give animal protein like fish and meat. In Odisha, we have known, and I had eaten there many years ago, is these Ahar canteens. Again, the same principle, 5 to 10 rupees for a very simple meal. How do they work? They work very differently in different states. So let me quickly start with the three states that are part of the survey. Even within those three, there are different models. So the Tamil Nadu model is that they appointed women in the first round of canteens that was set up in 2013, and then another round in 2015. And there's a team of maybe 5 to 9, maybe even 11 women who work together, and they take care of everything at the on site. So at the canteen itself, where people can come.
Like, where did how was the canteen set up? Who owns the building, and who buys? Is it a rented place, a hotel? Yeah.
So I think both in Rajasthan and Tamil Nadu, what they've done is they sort of looked for public spaces that were available to the government and carved out space from these existing nooks and corners to make a canteen. So it might just be the driveway of a government owned building where they might put a shed and they put some benches. In the case of Rajasthan, you have seating arrangement, whereas in Tamil Nadu people stand and eat. So a lot of these states, it's really carving out a little niche somewhere so that the canteens can be accommodated at the bus stand, in hospitals, at railway stations, shelter homes, etc. In Karnataka, it's a bit different. They came up with a standard template, and the same kind of building was constructed. It's a small room, with some space outside, and actually very pleasant environs where, the same template has come up in different parts of the city. So that's the physical space. Then there's the logistical arrangements, which I was talking about earlier. So in Tamil Nadu, it's all women. They're given some money, and one person is in charge of the accounts. They deal with the municipal corporation. I should add that, yes, the municipal corporations or ULBs, urban local bodies, they play an important role in most states. And the state government is making some allocations as well. This is some source of tension, I think, especially perhaps now in Tamil Nadu, where the state government is trying, I think, to palm off the cost to the ULBs, to the urban local bodies, and saying you make the budget for it from your own resources. And that's why in the past year or so, we've noticed that in Chennai especially, there have been news articles in the Hindu included, talking about how these canteens have become loss-making enterprises. They were never meant to be profit-oriented operations at all. They're a food security initiative. But in Rajasthan, it's still on the state budget. And actually, the center could play a role, and perhaps did play a role, at least during COVID, by providing the grain either either completely free or at a subsidized price. So in the ideal situation, all three would be involved. The central government would be giving grain from, that sits with the FCI. And then the state government makes some allocation. And the operations are through municipal corporations in Tamil Nadu, also with a very close involvement of the health department for hygiene, etc. In Karnataka, it's very different because there, they just gave it out to some organization where there's like a centralized kitchen, and I think this organization perhaps also has some religious over undertones. We don't know clearly.
By organization, do you mean a non-profit or an NGO?
Yeah, I think it is. I think it is meant to be an NGO. I don't think it's meant to be a profit-oriented organization. In Rajasthan, some of the groups that have been given, I think on the face of it, they're called SHGs, self-help groups, but in fact, they may not be. I think it's just a random contractor who, has put up some kind of an SHG in order to be able to get the contract. So there's no clarity, I would say, or there's no clear template about exactly how
So
to do
in
it.
Tamil Nadu, it is basically the urban local bodies who are sort of running it, but in Karnataka and Rajasthan, it's sort of contracted out to these organizations who do a centralized operation.
Yeah, yeah. One interesting contrast outside the survey states is Odisha, where the whole canteen scheme is running on a very small scale, but now all the canteens in the state are run by Mission Shakti, which is, as you know, the flagship initiative of the previous dispensation of self-help groups. So they have self-help groups that all are kind of federated under Mission Shakti, and all the canteens that exist in the state, Ahar canteens, are run by these women self-help groups. There again, it's 100% women like Tamil Nadu. In Karnataka, there are centralized kitchens, food is cooked there and transported to the various locations. So there may be 10 kitchens in Bangalore or whatever, and then the food is transported around 12 o'clock for lunchtime, and they have set times for making these supplies. But in Rajasthan and Tamil Nadu, they cook at the site itself where they feed people, so you can see in what circumstance, in what kind of hygiene conditions the food is being so there's a lot of transparency in that sense. And you asked also about the budget. So in Rajasthan last year, which was, I think, the peak year for the canteens, Indira Rasois, which are now renamed, by the way, they've been called Annapurna canteens. It was 700 crore rupees for the entire year. And they were planning to expand from urban areas into rural areas as well.
Right. 700 crores. Okay, so are these, as of now, I mean, not just in these three states, but elsewhere too, are they primarily focused on urban areas only? I mean, or is there a case at all for these canteens in rural areas too?
No, right. It is an urban area phenomena because I think the idea is that in urban areas, there will be people who come to the city for work, like maybe they have a court hearing, or somebody is sick and in the hospital, or they are traveling from one place to another at railway stations, they'll have a stopover. So, and there will be a lot of migrant population who may need this kind of support. So they are very much an urban feature. I do think that there is some scope for having them in rural areas as well. Of course, there the population density is much lower, right? So, it's not that easy. But in some of the vulnerable pockets, it would make sense. And in the past, there have been these emergency feeding centers, right? So even in Tamil Nadu, I think there was an attempt to allow elderly people who are quite fragile to be fed at the Anganwadis, right? And I think even in Odisha, in the KBK region, many decades ago, they had these emergency feeding programs in rural areas as well. So I think now, at least at bus stands, at at the tehsil level, at the block level, it would make sense to try and see what kind of response they get.
Right. So, in terms of the kinds of people for whom these canteens are a big boon, so to speak, when you spoke about migrant workers, and I was wondering if you can talk a little bit more about what kind of individuals frequent these canteens, because one would imagine, I mean, if you're speaking of migrant workers, one would imagine all these gig workers in particular, the Swiggy, Zomato, delivery guys, it's very unpredictable the day for them, and it's doubtful that they will be able to get home cooked meal along. So are these the kinds of people for whom these canteens are a blessing?
Yeah, so actually, these canteens are quite. The reason why I feel so excited about this scheme is how diverse the guests were, like in our survey also. Like you said, gig workers, we met a few of them, especially in Bangalore. And for them, they're on the move all the time. But even people like taxi drivers and auto rickshaw drivers, right? They can't really carry their food with them. And this came up also in the earlier study in Tamil Nadu, people who were running around the whole day as part of their job. How are they going to carry a tiffin from home on their cycles or bicycle or motorcycles? So for that group, definitely it's very helpful, but they're not the only ones. In Udaipur, for instance, there are daily wage workers who come from rural areas and they stand at these little labor chalks every morning to be picked up for work. And so like one or two canteens are situated at such labor chalks so that these laborers who come and don't really earn a whole lot and are spending money even on coming and going every day, they can get something to eat. So they're really the bottom of the pyramid, kind of, the lowest earning group. But even below them, there are some like people who are beggars who were surviving by asking people to feed them. People who are homeless, who live either in homeless shelters or at railway stations, etc. So that's really the poorer lot who are using the canteens. But there's also middle class and not so middle class people who were patronizing these canteens. So we met some government salaried permanent workers as well, a policeman in uniform, some doctors from a hospital. Actually, that was one of the most remarkable meals I had in Jaipur, for instance. It was a canteen that was kind of co-situated between a hospital and a municipal kind of office. So there were those kinds of people coming there. But from the hospital, we saw that the patients were there, the doctors were there, men who were working as sweepers were eating together with the lab technician. So, this very kind of very equalizing environment, right? Where the doctor and the sweeper and the patient and the lab technician, everyone is eating together. So there are middle and not so middle class people as well. And people have very different reasons for, relying on them. One of the permanent workers we met in Bangalore, he said his wife had gone home for her delivery. So clearly he couldn't manage on his own. But we also found a lot of people who have salaried desk jobs, young men who come to the city looking for, employment, etc. And they, even if they have a kitchen at home, they may not have time to do it, or they may not be inclined to do it. And many of them actually live in accommodation that is just a room without any cooking facilities. And the thing that across the board these people like is that the food that is served here, it's not particularly nutritious, but at least it's not oily, it's not spicy. And many of them said it's like ghar ka khana, it's like home cooked food. One of the young men we met in Rajasthan, he said, with my food, I also get maa ka pyar, like my mother's love, because he was clearly very fond of the ladies who were cooking in that canteen in Churu. Yeah, so like I said, very mixed, and also in terms of social background, it was very mixed. So like 1/5 of our respondents said they were Dalits. Half of them lived with their families. A quarter of them lived alone. 30% had no kitchens in their homes. 10% were salaried workers. The one group that was very missing is women. And we were kind of aware from our pilot studies that women tend to be very few in number at these canteens. So all the investigators who participated in the survey were requested to really, like, if they spotted a woman at the canteen, eating at the canteen, then they should definitely try to interview her. And yet in spite of these special efforts, they were just about 10% of our respondents.
Is that linked to the pretty poor women's labor force participation rates in India? Or is that an independent?
I think it seems to be that women are mostly homebound and not going out very much. But even then, it was surprising that even in a place like Tamil Nadu, they were not visible to us. So I don't think it's that much to do with labor force participation rates. I think it's more a social norm that women are out and about much less than men.
Yeah, right. You also mentioned that there was a good proportion of Dalits, and there was a mixture of classes. You have doctors as well as sweepers, lab technicians, and daily wages together. Like, did you see this kind of sort of a mixed composition in terms of the staff who are hired and who are cooking in these canteens as well, or is it more of a stratified kind of a staff?
No, so even amongst, so actually we were asking, we had two sets of questionnaires. One was for the guests, but we also talked to the staff at the canteens. And we were, in both cases, we were interested in asking about their social group because, especially when it comes to food, one hears about discrimination.
Segregation around food, yeah.
That's right. And also, if you recall, when the midday meal scheme started across the country, around after the Supreme Court order in 2001, many states, and it continues to happen once in a while even now, if a Dalit cook is appointed to cook the meal at school, then sometimes the local community starts grumbling and they even go further than that and they ask for the cook to be removed, etc. So we were concerned about something like this also happening in the canteens, but both in Rajasthan and Tamil Nadu, where cooking happens on site, we found that the cooking team was very mixed.
By mixed, you mean there were Dalit cooks as well?
Yes. So actually, I was just coming to that. There's not that much segregation or hierarchy amongst the teams that cook. So like even within the half an hour or 1 hour that we may have spent at a canteen, the same person could, just now be washing dishes and then be sitting at the counter taking money and then, sitting and kneading the dough to make rotis. So it seemed, I have to add, it seemed like there was no clear kind of, discrimination, and certainly none of the guests complained, didn't say that they didn't feel welcome or anything like that.
Right. So, in your survey, Ritika, you also flagged certain findings which, let us say, are not very positive, like excessive surveillance, use of marshals to monitor the issue of tokens, etc. So, were these specific to any particular state, or were these present in one way or the other in all the three states that you surveyed? And what exactly is this surveillance for, and all this? What is it about?
Yeah, sorry, the last one I ended on saying that nobody was feeling unwelcome. In fact, we met a lot of old people for whom they felt very welcome at the canteen, and it was kind of like this place they could go to when they were feeling lonely or,
A communal space.
yeah, the sense of community. Yeah, like the sense of community. Or some of the women workers at the canteens, they would tell us that, we keep food aside for him because he comes every day. They knew he's homeless. And so there was this kind of sense of caring, just a little bit, the anonymity of the city going away for these lonely hearts in the city. It was kind of touching to see. Also, people who had like difficult personal circumstances in the sense of not getting along with their spouse or children. Even for them, it just felt nice. It seemed that they were able to come and just eat a meal over there. But coming to your question about surveillance practices, it is really the most bizarre one was in Bangalore city alone. Not even in Bellary and Mysore, which are the other two cities we surveyed in Karnataka. In Bangalore alone, they had employed these marshals.
Were they in uniform and all that?
Yes, they were in uniform with army boots and overalls. It was really bizarre, and so nobody was able to really tell us properly. I looked online and found some news articles, and I think they made an appearance around COVID. because I think they were trying to keep people in their homes. And somehow these marshals ended up also at the canteens. And actually, they don't have that much of a task. I mean, the ostensible reason for having them there is because they note down the number of meals that have arrived in the morning when the truck comes. And then they keep an account of how many were served and how many are in balance, etc. And they're supposed to keep an eye on the person who's serving to see if they're giving proper helpings and that kind of thing. But this kind of task can be done by making surprise checks, because if the marshal is there every day, then he is likely to get co-opted in this whole system anyway. And what was funny is that while the workers of the canteen were being paid around 10,000 rupees a month, these marshals, who also have a pension of about 29,000, we were told, were on top of that getting 25,000 rupees a month for this work. This is what one or two of the marshals told us. Then they said, no, don't tell anyone about it. So this was in Karnataka. It was quite distasteful actually to see this. They were not nasty to the guests or anything like that, but they were completely superfluous. And it seems like such a waste of money also. In Rajasthan, again, I think the idea behind it is to keep an eye on corrupt practices. And so what they do over there is, when you go to eat, you have to first stand at the billing desk. There's a little camera and you have to have yourself photographed. Then you have to give your name, your father's name or husband's name, and your address maybe or something, and your mobile number. And they're not particularly strict about it. So like if you say, oh, why do you need my mobile number? They'll say, okay,
So
fine.
how does this work with beggars and all that? Because they may not have all this mobile number.
Yeah, so I think they just put somebody else's number, or maybe they're even allowed to override it. I'm not sure. But the ostensible reason for this is to be able to have a trail, like a digital trail of how many people are supposed to have eaten at the canteen. But I think, first of all, it's not very strictly implemented, and thank God for that. But the other thing is that even if they were to implement it strictly, I think people may have found ways of cheating the system. So on the one hand, you've introduced distasteful practices, and on the other hand, it's not very clear whether they are meeting the objective of keeping a check on corruption. So it seems like a lose-lose kind of proposition. I'll give you one example of why, very specific example. One local daily in Rajasthan, they claim to have done some forensic analysis of the CCTV outside some 3 canteens in one district. Okay. And so they looked at the hours and hours and hours of CCTV footage to see how many people have entered the canteen. And for those days, they counted the number of tokens that were issued. Okay. And they found a mismatch. The number of tokens was more than the number of people who entered the canteen. And then that was presented as evidence of corruption. But actually, even in our survey, we found that many of the people who eat at these canteens, they buy 2 or 3 tokens, because for 1 token, you get only 5 or 6 rotis. And that's not enough for somebody who does manual labor, right? They need more than that. So you may have more tokens and fewer people than the number of tokens, but that doesn't necessarily imply corruption. So yeah, it's not very clear, and I think they need to think a bit harder about the corruption question and come up with less intrusive practices for doing this.
Right, less heavy-handed than having this overpriced, expensive marshals coming into this scene. So you spoke at the beginning, Ritika, about how when the government which introduced these canteens, when they went out of power, they began to suffer from some kind of neglect and so on. But if they are really popular, doing a job, doing a service for the people, for the average citizen, isn't it in the interests of whichever party comes in power to sort of keep it going, build upon it, or it doesn't work like that?
Yeah, so in politics we always hear about upmanship, right? One upmanship, but here it seems to be a case of one downmanship. So like the person who started the canteen, when he or she is thrown out of power, then the next chief minister or the new dispensation seems to say, I'm not going to let this legacy of yours survive. And I think one example, very recent example, is what's happened in Andhra Pradesh, because they had these NTR Anna canteens. And when NTR went out of power, they were en masse shut down, right? Like, I think almost every single one of them was shut down, maybe not 100%. But as soon as he's come back to power, at least he's announced that they will reopen. So in other states, it's not been as blatant. So in Rajasthan, where we were worried that as soon as this Congress is voted out of power, the canteens would be shut down, like we had seen in some other states. What has happened is that they've only renamed the scheme, which is fine. There's no problem with that.
So that seems to be a workable model. Let everybody rebrand it and then keep it going. It can be rebranded every 5 years, I suppose.
Or they can just come up with some kind of neutral name which is okay with all political dispensations. But hang on, in Rajasthan they've renamed it, and that's really not an issue as far as I'm concerned, and I think as far as the scheme is concerned. But what they've also done is they've artificially put caps on the number of tokens that can be issued per meal time. And in the 2 or 3 that I visited after this new dispensation came to power, the number of tokens had been halved. And nobody knew on what basis they had been halved. So this is a very dangerous practice, right? Because now in the earlier practice, when people could just show up and they would be assured of getting a meal. In some places, we saw them cooking afresh at 2 o'clock or 3 o'clock, because the dough had run out and they needed to make more rotis. Same in Tamil Nadu. They might start steaming more idlis if they see that the idlis are finishing. But when you issue a cap on the number of tokens, then people will start getting turned away. And once that happens, then they'll lose the confidence in going there at all, right? They'll say, oh, last time I went there was no food, so better not go there, let me do something else. And that will slowly kill the program. So I think this problem is pretty serious, and unless there is some kind of protection.
Isn't this similar to what happened to and what is being done to Narega? Where you don't give a full 100 days of work, you hold back wages, and slowly people stop looking.
Exactly. That's a great analogy, actually, that you kill the program in this kind of quiet, under the table way. No, and you say, yeah, we'll give more money, etc. But actually, you do everything to undermine it.
Right. Now, what the big question which I've been wanting to ask from the beginning, and which everybody, I think most economists, in fact, also would want to ask, when you have PDS where you are giving out subsidized food grains, why do we need another institution which also runs on subsidized food grains, which is this government canteen? Isn't both the same thing, the food subsidy in different forms? Why do we need so much of fiscal pressure on this time on state government revenues, when you already have their revenues under pressure because of this whole GST effect, and there is talk of gravity culture? We want people to be independent and self-reliant, not keep giving them more and more subsidies. So what is the answer to this whole question which comes up?
Okay. So first of all, I think that the PDS and the public distribution system and these canteens should be seen as complements to each other as far as food and nutrition security is concerned, right? Because the PDS will fulfill the needs of people who have homes where they can cook, who have the time to cook, etc. Canteens are serving those who are, migrant workers in cities without cooking facilities, people whose jobs require them to move around all the time, and so on. That's one part of the story. Now, this other part of the story about why do we need them and the fiscal pressure, etc. I think we have to start with the basic question that, do we see food and nutrition security of people as a right and as a matter of dignity or not? If the answer to that is yes, then this is canteens. I mean, now are quite a cost effective way of doing it. Compared to the PDS, they don't cost very much at all. And what they mean, what they give to people in return, on the other hand, is quite substantial. So for every meal, according to our survey, for every meal on average, people said they were saving 60 rupees. So even if they're eating there just once a day, and many of our guests were regulars, that's a saving of more than 2,000 rupees a month. Yeah. On average, their salaries of these sample, of the guests in our sample, was around 10,000 rupees. So it's a pretty hefty saving as far as these people are concerned. And it's not just a question of money. It's also, like I said, a question of convenience, right? It's right there and you can rely on it. There's the sociability aspect. And on top of that, I think these canteens also help to control the market for street food, or to put pressure on it in ways that it works better for people. One, of course, is that, if I'm if I'm looking for a quick meal in a new city, then my option is to go and have an 80 rupees thali and have a 8 rupees thali at an Indira canteen. And if that option is actually a reliable option, then obviously the private sector operators, they will have to reduce their prices a little bit. And this came up in the Tamil Nadu survey. It's an older survey of the Amma canteens. But more importantly, if the canteens give good, nutritious food, right now, this is a big problem. They're not giving enough buttermilk or yogurt or eggs or fish or anything like that. But they could do. In Jharkhand, for instance, you get the dal bhat for 5 rupees, and then you can add another 5 rupees and you'll get a boiled egg with it, right? So you can have these simple top ups for people. If the canteens start paying attention to nutrition, like Jharkhand, or like I said right at the beginning, like the Brazilian case of popular restaurants, where in fact there they even hire nutritionists. There's a nutritionist who is overseeing the menu and ensuring that all the main nutrients are supplied in every meal. So then it would also put pressure on private street vendors to start thinking about providing more nutritious food than just momos and noodles and chow mein or whatever it is that you get at these street vendors. And then some people also say that, we can bring portability for migrants and they can buy their ration in the cities, etc. But we saw during COVID that, these states which had the canteens available were able to, it was such a great infrastructure to have. It kind of, at that time, you could see that, canteens should be viewed as an essential service, just like ambulances and hospitals. You could see it like that. And that glimpse also came through, by the way, during our survey in Chennai, where some of the workers, they said even during the floods in the city, they had managed to open and to serve meals. And they were quite proud of the fact that they had been able to provide this essential service to people whose homes had been ruined by the waterlogging, etc. So I think in the end, the two are complements. I don't think the canteens are terribly expensive, and they're certainly worthwhile.
Right. I mean, I think you made a pretty strong case for having canteens, as you said, as an essential service. I mean, it's not just about savings, which are in fact substantial when you think of the economically marginalized and vulnerable populations which come to these canteens. I mean, 2,000 rupees on a saving of 2K on a salary of 10,000 is indeed substantial saving for the poor. And then you also spoke about the nutritional value provided. Of course, the nutritional value is a little bit improved as well. And then the compared to the street food, I think definitely whatever food we have as of today, I think would be much more nutritious in any case. Now, one last question, Ritika, before we wrap up. So there are we have seen that there is a lot of positive effects coming from these canteens, and you made a case for having them as a complement to the PDS. Having them institutional, because as we saw in Tamil Nadu, you said During floods, they sort of made their function really felt, made themselves useful. Now, what are the recommendations, let us say, that you would suggest going forward in terms of making these canteens more institutionalized across the country, and also making them more responsive in terms of social policy goals such as nutrition, accessibility, and ease of access, and so on?
Right. So, I mean, I can certainly make recommendations based on our understanding in these three states. Let me quickly do a quick fire. So, in Rajasthan, I would say that the state government should remove these gaps immediately. And in all three states, this is for all three states, they should start thinking seriously about improving the nutrition. And it's very easy to do. Even in Rajasthan, we saw people carrying a packet of buttermilk or some yogurt to complement the meal, to go with the meal. That's in Rajasthan. In Karnataka, I think they should have a serious rethink about centralized kitchens because, transporting food, it tends to get cold, it tends to run out because there are, fixed number of meals that are supplied. Then people are turned back and then they basically give up on those particular canteens. And then, of course, this really nasty surveillance practice in Bangalore, which I really don't know why it continues unquestioned. In Tamil Nadu, there's a lot that can be done, and they would get a lot by doing very little. So, because the canteens are more than 10 years old there, the infrastructure needed a lot of attention. There were deep freezers which were not working, fans were not functional, the signage had gone completely, dirty and all of that. So, just a simple, fresh round of paint and fixing all their infrastructure would help quite a bit. RO systems, they had RO systems at the canteen, which hadn't been fixed. Then the second big one is revamping the menu. The workers themselves had a lot of different suggestions: boiled eggs, tea and coffee, buttermilk. Don't only ask us to make sambar with the chutney. Why don't sambar with the idlis? Please let us make chutneys also, because, so people also have some variety. And then I would say in a state like Tamil Nadu, there's no reason for them not to have nutritionists who would then do provide inputs for not just the canteen program, but also Anganwadis and noon meals and the breakfast program, right? So they have a lot of different feeding programs in the state. And if they can get some nutritionists to oversee everything, that would be quite good. And then the third important thing in Tamil Nadu was the workers were very bitter. In fact, they felt a little bit nervous because they thought, this canteen is called Amma's canteen, and that's why we are being neglected like this. And so, and their ask was very little. They were being paid at the time of the survey. They were being paid only 300 rupees a day. Now it's been increased a little bit, I think, to 325 or 340 a day. They don't get a weekly day off. If they take the day off, they have to suffer a cut of wages for that particular day. They have no benefits, provident fund, accident insurance for burns. Some of them did complain about these accidents while cooking. So just very basic provisions, fair working conditions for women who are working hard and also providing such an essential service. And, if the state government was to do a brand new menu and improve these workers' conditions, they could, it would be like a all new scheme almost. And they could quite easily seize ownership of it as well.
Right. I think three broad themes I see in your recommendations, Ritika. One, of course, better infrastructure. All those freezers which are not working, those RO systems need to be revamped. A better menu which makes the food more nutritious as well as more variety. And thirdly, of course, most important, better working conditions for the workers who don't get a weekly day off, and better pay. And hopefully they'll be getting full-time jobs as well, instead of being on daily wage kind of a system. Thank you so much, Ritika. Any one last thought you want to add to this?
Well, I just hope that many more people will go and eat at these canteens, and that more media will pay more attention to these canteens, and more researchers will try and study them in different states where we haven't been able to go.
Right. Thank you so much, Ritika. On that note, we wrap up. It was an absolute pleasure listening to you talk about your survey the findings. You even had quotes from the different people you spoke to. It was really interesting for us to listen, and I'm sure more people, as they come to know about this from different caste backgrounds, will go and patronize these canteens, and hopefully they'll be here for the time to come. Thank you so much once again.
Thank you for doing this.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.